Hi, I'm Preeti from Shield Healthcare, and today we are delighted to welcome Dr. Priya Kannan, Senior Consultant at Dr. Mehta's Hospital and GFC Fertility Center, an expert in maternal medicine and high-risk obstetrics. She's an executive committee member at Oxy and also a Southern Zone Foxy quiz committee member. She has contributed to a lot of academic quizzes and she has also actively taken part in post-graduation courses. Today, we are not just going to talk about PCOD, but we are actually going to decode it. And I have the renowned doctor in the city, Dr. Priya Kannan here, who's going to answer all the questions that every woman is afraid to ask but deserves to know. So, thank you for joining us, doctor.
Thank you for the opportunity.
Doctor, my first question is what is PCOD? Is it like, if a woman is diagnosed with PCOD, everybody starts saying that, okay, fine, she's not going to bear a child. It's an end of motherhood. What is it? Why is that, societal pressure?
See, this is a myth which people should understand. Okay, PCOD and PCOS are both the same. Okay, initially we used to call it as polycystic ovarian disease. Now we are not even calling it as a disease. We have changed the terminology, calling it as polycystic ovarian syndrome. It means a multiple combination of things which happen together. That is called as PCOS. So coming to fertility, this was a myth. Fat girl will never get pregnant. This has been a proverb. In some local languages, they even have it in a beautifully, with rhyming words, they put that. But it is not true. Okay, what does PCOS means? It is a immaturity of the follicles.
Okay.
So normally you have ovarian follicle. By your day 2, a small follicles get recruited. By day 5, they grow to a medium size. And by around day 14, they expected to grow to a bigger size. And then they start ovulating. In the women who have PCOS, this process doesn't happen. The follicles get arrested in a medium-sized follicle. By day 5, whatever the medium size is there, it gets arrested. So over months, these arrested follicles get accumulated and they form a cyst. They are not actually cysts. Cyst means anything which contains water.
Okay.
So people really think polycyst means many cysts. That is also wrong concept. It is a immature follicle.
Okay.
And these patients can face a little bit difficulty to get pregnant. They may need some medical help. So it means that they cannot conceive is a wrong term.
Okay.
It is a correctable treatment, and with lifestyle measures are the first treatment. If the healthy lifestyle, they'll be able to conceive on their own. So that is what I tell all my patients. You try to shed a few kilos, get on to a healthy lifestyle. You will conceive like magic. It's just the magic, it just works out without any treatment at all.
So it's nothing to fear about. It's just another indication which can be treated, and there is nothing like any.
Absolutely, it can be treated. It's nothing to be feared at all. And PCOS will never cause infertility if you have a healthy lifestyle. So the main concept here is having a healthy lifestyle, and it is a very much correctable cause for fertility. So we don't even call infertility nowadays. We call it as subfertility, which means they are fertile, but they are little less fertile than the normal population. So it's a correctable cause of subfertility.
Wow. Thank you. Thank you, doctor. And you just spoke about lifestyle and reduction of weight. That actually triggers one more question in my mind. Is it something, PCOS is something related to weight? Because a lot of people keep saying that you're overweight, so that is why you have PCOD. So is it something related to weight?
Not always. Like most of the PCOS women are heavy. Almost like 70 to 80% are the obese PCOS. But we have a small subset of women who are called as lean PCOS. We'll be like, they're very thin. Their BMI can be 18 or 19. We'll tell them you eat more. You're very thin. But still their ovaries can be polycystic. So these women, we call them as polycystic ovarian morphology and lean PCO. Okay. So they are very thin, they are very lean, but still they have the PCOS. So why does it happen? The basic pathology is the same. It means they are healthy, but the healthy weight is not about having more muscles. These women, they have more of fatty tissues in them. Okay, so these women, they can have a small belly in them. They can have a little bit of fat deposition in the internal organ, which is not seen. When we go on a surgery, for example, when we do cesarean on these kind of lean women, when we go there, all their organ will be covered with fat. They will have visceral fat. The fat which is surrounding the internal organ, we call it as visceral fat. And these women will have more fat in that. So the same pathology, the same problem, the treatment is the same. So same diet advice for the lean women. So when the PCOS women come who's lean, for example, the women weighs only 50 kg, and I sit and tell them about how to eat healthy. Okay, sometimes their relatives get very angry. Already she's very lean, and you're thinking of giving her a diet. This diet, what we mean is by reducing the amount of carbs and fat.
Okay.
And increasing the amount of protein and fiber. So that is what we call it as healthy diet. Eating less doesn't mean eating healthy. So it is not about being heavy at all. Even lean PCOS are also a problem which has to be treated, and they'll have the same problems with the obese women also have.
Beautifully said, ma'am. So eating less doesn't mean you are eating healthy.
Exactly.
Yes. So then my next question is there anything that is related to periods, regular or irregular periods? Because a lot of them tell that I have irregular periods, so I think I have PCOD. But is there any cases where the periods are regular but still they have PCOD?
See, in PCOS, we have 3 types, okay, and morphological types we call them. There are 3 parameters for us to diagnose a polycystic ovarian disease. And in that, out of the 3 parameters, if 2 are positive, we call them PCOS. So one of them is irregular cycles. The second one is hyperandrogenism, which can be either a blood test showing male hormone, or it is a male features of hair growth, acne, hair loss. So this can be the second feature.
Okay.
And the third one is a polycystic morphology by ultrasound. If a patient has regular cycles, but the other 2 parameters are abnormal, for example, she has hair growth and she has a PCO pattern in the ultrasound, she is polycystic ovarian disease with even though the cycles are regular. That is one. Second thing is the PCOS, the problem here is about ovulation. And though we say these women have regular cycles, it doesn't mean that they are ovulatory. So usually it is a presumption. When we say a patient has every 30 days he has a cycle, or every 28 days she cycles, then we presume that yes, ovulation has happened, but it is not always the case. Regular cycle doesn't mean ovulatory cycle. They can still not ovulate but have a regular periods.
Okay. Which means they have the ovaries. I mean, the eggs are all there. They have eggs, but they're not ovulating.
Exactly. So these women, they'll have more eggs. Okay. So what people think is, more eggs, meaning more pregnancy, more babies. That is not the fact in PCOS. What happens is that though they have more eggs, the quality of the egg becomes very poor because of the androgen excess. These women have male hormones. All of us have male hormone. Okay, a little amount of male hormone is needed. The muscles are built mainly by the male hormones. So a permissible amount is there for women. When it is excessive to the permissible amount, then we call them abnormal. So when the male hormone is very high, it changes the quality of the ovaries, quality of the oocyte. So when PCOS women, especially when they go for IVF, they think I have more eggs, I will definitely get pregnant. It's not the case. If your diet or if your lifestyle is not good, your quality of the egg will be extremely poor. You will not get mature eggs. So the maturation will never happen. And if maturation never happen, pregnancy never happen. So even in spite of, for example, they will be getting out 20 eggs, but out of which only 2 or 3 will be growing into embryos. They'll grow into big, the babies. Embryo, we call it as a baby which is made in the test tube. The other remaining ones, they go wasted. They don't grow to a good quality eggs. So that is the problem with women. Too many eggs in the basket, but not the good quality ones to give something fruitful like a pregnancy.
So the number of eggs doesn't matter in this case.
So it is the quality of the egg which matters, and that comes with your lifestyle.
Talking about excess androgen and the male hormones, all those things, is that the reason why a lot of PCOD women, or generally speaking about women, they have hair growth on the chin, facial hair, whereas they have hair thinning at the head? I mean, they have the natural hair thinning. So is it one of the reasons?
Exactly. See, the basic problem which all women complain is you have hair where it is not needed at all. Okay, you don't want a mustache or a chin hair or a beard as a woman. But everybody likes to have thick and long hair. But the opposite happens with the women, where you have hair where it is not needed, and the really needing area, your scalp hair falls down. This is the problem with the androgen. Okay, so this is a male type of pattern. You can see men, they'll have a male type of baldness. The center baldness is a male type. Usually females will not lose hair on the center. The central baldness is male type of baldness. So
Okay.
that is because of androgens. So these women will lose hair, and the hair on the scalp becomes so thin that it becomes fragile and breaks. So they will definitely lose hair, but they will have more thicker hair. See, usually a small amount of thin hair on the chin or on your upper lip is normal.
Okay.
That is a female pattern hair,
Okay.
which will be there for most of the women. We are not talking about those things, but for PCOS, it will be a little coarse. They'll be a little thicker. It will be like similar to the male pattern. And definitely, it is cosmetically, it causes a problem. And one thing is that about hair, like once the hair has appeared, the tablet or your diet, anything will not reverse the hair changes. You need some other cosmetic treatment to remove that.
Okay.
But your lifestyle improves and further hair production doesn't come there.
Okay.
So if your lifestyle is good, so people come and ask me, what is the meaning of lifestyle? Okay, I always explain that lifestyle has 4 components. Most of the books or most of your literature says only diet is important. Okay, 80% of your treatment is diet. We agree with that. But according to me, the other 3 components are also important. The second one is exercise.
Okay, ma'am.
Third one is your stress relief. Okay, it doesn't mean that being at home, no stress. Being in a college, no stress. No, nowadays everybody is stressful. And we are not only talking about the stress, meaning like, people who scream are stressful, they don't. If you keep it inside, you're stressful, it is there. You have you don't sleep in the night. You go strolling with your reels and shorts. That is a stress. Okay, that is a stress your body feels. And the fourth important component is sleep. Okay, sleeping in the night time is very important. At least by 10 to 11 o'clock, you should fall asleep. A minimum of 7 hours of sleep is very important. Why is that? We have a circadian rhythm. Okay, our body is tuned in that way. Whatever problem happens in the morning heals in the night. So that is why when you have pain in the night when you sleep, okay, by the next day when you wake up, you look fresh.
Yes.
Okay, when
yes,
you have a
ma'am.
good quality, your pain goes off because your body has a natural mechanism to heal. But when this doesn't happen, okay, you don't sleep by 2 o'clock, 3 o'clock, you don't sleep. And you sit and you stroll, and then you sleep around 4 o'clock. Even if you sleep till afternoon 1 o'clock, your circadian rhythm doesn't work there. Okay, your health lies in sleeping in the night time. Your peak repairing system happens in between 12 to 4. So
Okay.
that period, you should have a deep and good quality sleep.
So proper sleep is like repairing mechanism, and
Exactly.
it should be done at the right time.
Yes, because
Okay.
if you see some celebrities, like, if you see their diet chart, their lifestyle pattern, most of them will never skip the sleep. They have a particular time to sleep. Most of your like top celebrities, they avoid parties in the night because they cannot compromise on the sleep, and it definitely gives you a very better, good-looking skin and a good quality health. Even if you want to build muscles, you have to have a good quality sleep. Otherwise, whatever workout, your muscles never get repaired. You are going to cause more injuries rather than building beautiful muscles.
Okay. Okay. That was a nice thing that you mentioned about sleep as an important factor of having a
Very
healthy
true.
lifestyle.
Yes.
So along with sleep, you also mentioned about diet.
Yes.
What is the diet parameter? Because a lot of social media platforms, I mean, a lot of contents in the social media, they talk about diets. They talk about diet teas, diet charts, and they talk about you have to drink this, you have to eat that. So that, is it all cure or is it all partial truths? Can we believe that?
See, basically, your diet or the treatment basically for PCOS, it's not social media. Okay, it is a better social life rather than a social media life. Okay, which means what you do in your free time, that is your social life. Okay, even when you work, when your official part, what you eat really matters. Okay, like see what happened is once I was invited as a speaker for one of the IT sector. Okay, I was happy to go there, and they served me very healthy ones. I was literally impressed. They served me like goas, and they gave me almonds. So I was like very happy. But I just took a turn around me. Everybody else was eating pizzas and samosas. Okay, only my plate was filled with goa and almond. So I asked them, they said it is available, healthy choices are available, but people mostly prefer the fried ones. So it is a choice which people make.
Okay.
So once in a while, it's okay to eat these unhealthy stuff. But if you eat it on a regular basis, it's going to spoil your health.
Okay.
Okay, see, I tell most of my clients, okay, not to give up on something which they like. See, for example, you are a person who cannot live with samosas. Okay, giving up on that, it's going to increase your craving. So the
Correct.
moment you see that you want to eat 3, 4, you want to eat it every day. So the same thing for biryani is the same thing for fried rices. So I tell them, if you want to eat, take a small quantity. Eat it on the early part of the day and skip one of your meals. Take only salad for that meal and do an extra workout so that these calories don't go and sit and cause you problem. So
Wow.
it is like, you can eat what you like, but you need not give up on that. See, there have been loads of information given on how to eat biryanis. Everybody knows that, but we are not following that.
Correct.
What is it is you take the pieces for yourself. You take your eggs, preferably egg white, but if it's only one egg, you can take the whole egg. Take your raitas long and only decrease the quantity of your rice. That is the best way to eat biryanis. Okay, so I mean, a chicken is a preferable one because your red meat puts on weight. So you can get your chicken. I mean, the other things like fish is okay. So get those things, get the pieces, get your eggs, maybe reduce the amount of rice, and always have a salad in front so that you don't feel very and eat slowly. We
Okay.
have something called a satiety center, which is there in the brain. It gives a signal when to stop eating.
Okay,
Okay,
ma'am.
so if you eat slowly, for example, if you eat for 20 minutes, okay, your center tells you that, okay, you're full stop. And then you definitely stop because you'll not be able to eat more. But we see
Okay.
people just eating such a speed. So before the 20 minutes, you almost eat 3,000, 4,000 calories. Then your weight doesn't come down. Okay, so if you have noticed the very thin looking people, they sit and they munch each bite. They sit and waste, we feel they waste a lot of time in eating. No, but that's a healthy way to eat. The other, I will tell you, it's more of a myth rather than the truth about dairy items. Okay, about the milk products. Okay, see, milk, yes, it contains a little bit of estrogen, okay, a little bit of hormones, which can cause a little bit of worsening of your polycystic ovaries, but it depends upon the quantity. If you're going to drink liters and liters of milk, we agree.
Okay.
Just a single glass or 2 glasses of milk, it's not going to be a problem for that. Okay, and
Okay.
the other thing fat they think is about gluten. Gluten is nowhere related to your polycystic ovaries. The one thing which I tell all my patients, it's not only the fat which is the responsible. The main problem with polycystic ovaries is a carbs diet. Your
Okay, ma'am.
carbohydrate is in excessive quantity. See, ideally, a diet should have 60% carbohydrates, maybe 50 to 60. Most of your Western diets are tuned to that. You get a breast piece or a chicken piece, which is like more than one third of your plate. Then you have a salad, which is one third of your plate, and the other one third they add either potatoes or sweet potatoes, which is a healthy carb. So
Okay.
the carb quantity is just one third of your plate filling. That is a healthy kind of diet. In Indian diet, most of our diet is more of carbs. We
True.
we
True, ma'am.
forget the two important component. One is protein, the other one is fiber. Okay, so proteins, if there are vegetarians, we can add with either your chenas, your dals, your sundals, your sprouts, those are good sources, or your almonds and other things, which will give you a protein. Okay, and then fiber is about your vegetables, your fruits, and millets.
Okay.
Reducing carbs is the important part of PCOS diet. And people come and ask me, Doctor, how long you want me to be on diet? Okay, this
Okay.
is a lifelong disease. So, till the time you want to be a disease free, you have to be on diet. The moment
Okay.
you are ready to
Okay.
take tablets, then you can leave your diet. They will give you a bunch of tablets. You can put tablets and eat. So, either it is your food healthy or it is your tablets lifelong.
So it's not always gluten free, sugar free. blah 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 free and all. It's
No.
just pure lifestyle diet
See,
based
initially,
thing.
when sugar frees were introduced, okay, especially your stevias and other things, everybody were crazy. We really wanted to, try that. We thought, okay, you can enjoy all the sweets, so sugar free, enjoy. But now there are loads of researchers who's come back saying that those are not healthy. One thing is, we don't have researchers to say whether they cause cancer or not. We don't know.
Okay.
The second most important thing is you are cheating your body. You are cheating the hormones. Okay, your tongue recognizes the sweet, but the hormones inside are not knowing it. So
Okay.
in that way, it doesn't correct the inner metabolism. So they say it's better rather than to take a little bit of sugar, be happy with it rather than taking a sugar free in much quantity and enjoying a sweet there.
So if I'm taking an alternative of sugar, my body will not recognize it as a sugar.
Yes.
But still I'll have the sweetness in my body.
Sweetness in your throat, you will, I mean,
Okay, ma'am.
in your tongue, but that they say you should not alter your sugar manure in that way. That is
Okay.
not the healthy one. And the other fad thing which people try to do is they go for brown sugars rather than the white ones.
Exactly. I wanted to ask this as a next question because you mentioned about sugar and stevia.
Yes.
So what about, because a lot of people are consuming brown sugar. Even I
Yes.
consume brown sugar, ma'am. So
Yes. See, the one thing is that both are sugars. Okay.
Okay.
Your brown sugar is little bit healthier than the white sugar. We agree. Okay. But if you want to take a brown sugar in a coffee, example, okay, where you're going to add maybe half a spoon of white sugar, you need really 1 or 2 spoons of brown sugar to get the same taste.
So it's the same quantity of sugar.
Yes, so the overall is that you increase the quantity of brown sugar, whereas your white sugar, even lesser quantity, it keeps it very sweet.
Okay.
So
Understood, ma'am.
both are the same. There is no much of difference with the the color you add.
Wow, that's a thought-provoking message. And one more beautiful message that you actually mentioned is it's about the social life. It's not about the social media life. That's something that
Yes.
I really got, I was really happy to know about
No,
it.
it is very true. Okay, see, social life is a social discipline. Okay, your discipline should be throughout the year. Okay, every day, every meal matters. See, what people do when they are dieting. Okay, what is the main problem is that they diet, okay, and every week they have a cheat day. Okay,
Correct.
and
Yes,
that
ma'am.
one cheat day, it almost covers the whole week's calorie.
Okay.
They eat almost like 4 to 8,000 kilocalories a day. Okay, just 7,000 kilocalories will give you 1 kg weight gain.
Okay.
So that whole weight, that whatever you have reduced, you just eat it in one day, gain it in the same day, and people come and say that, okay, I've tried all through, doctor, but I'm only gaining weight, not losing only. That is why I say every meal matters. So every meal, whatever you like, you take it. Quantity control matters. Don't give up on something which you like. Then your craving never happens at all. I don't believe in people saying don't eat rice at all. Eat it, but a very small quantity.
Okay,
See, the
ma'am.
ideal amount of rice which we should eat is a very small katori of rice. Exactly 4 tablespoons is the rice quantity per day you can consume. Okay, which is like, for example, in any vegetarian restaurant, you are having a proper idli or a small cup of sambar they give you. That should be the quantity of rice which you eat. Okay, not the
Okay.
big bowl of rice which they give us. So if we eat in that quantity, okay, your health is going to be good. Okay, then now again I'll tell you, most of the patients, they come and fight also. These, or I've seen a lot of social medias where they come and tell you, this rice has been there for years together. Okay, we have been rice consumers for maybe, I think 60, 70 years, maybe more than that also. Okay, nobody has told don't eat rice in in this quantity. Why are we talking now? Because physical activities come down.
True.
Okay, initially we were doing farming. Okay, so farmers can eat even this much of rice because their calorie burn is too much. They work out too much. So they can eat anything which gets digested.
Okay, ma'am.
Okay, and then they'll come again and argue. Are everybody doing farming? What are you talking about? Okay, did we have so much of bikes like that? Did we have Swiggy or Blinkit? Okay, did we have anything before, maybe say 10, 20 years back? If you want something, you walk.
Correct.
Next street, you walk. 1 kilometer, you walk. 2 kilometer, yeah, next area only. I will go and get it. Or you take a cycle, you go to the next area, come back. So physical activity was very much high few years back. Now we either order it online so that they come it. Yesterday I saw a very interesting, one of the post which was there. Okay, like they gave it to a delivery guy. One box was given, and then he went to some place, and then they said, there was a dustbin. They said, please drop it there. I didn't want it to go to the dustbin and threw it. So I ordered, so you go and drop it. So that is the amount of laziness which we feel. Many of my clients who are all young children, maybe they're, like teenagers and early part of college life. The mothers come and complain to me. Always my daughter lies on the bed and rolls on the bed. 24/7 she lies on the bed. Food also I take to the bed, she eats and then she's there. She always on the bed, never tries to move. A little bit of water also, she screams, "Mummy, bring the water," and mummy handles it.
Okay.
So this is the major drastic change which we are facing now. Okay, now we have a research which says that India has most obesity throughout the whole world. Okay, we really thought we are not there, but our children are becoming on the heavier side. We are facing obesity in nothing. So we have to take a serious step about moving. See, initially there is some organization called as ESHRE. ESHRE is the European Society of Reproductive Endocrinology.
Okay, ma'am.
Okay, so this used to give guidelines about how to treat PCOS.
Okay.
And initially, maybe 5 years, 10 years back, ESHRE said simple walking is not enough. You have to walk like how do you do a power walk? You have to for example, if you have a thief running, but you're a little embarrassed to run, so you walk fast. So in that kind of speed, if you walk only, it is useful. That was ESHRE's guideline quite some years back.
Okay.
Now ESHRE itself is changed. It said at least walk. Get up from the bed. Get from your room to the sofa to the bed, you walk. Okay, while seeing TV, you walk. At least something, some movement is needed. So that is what we are saying. The more you move, this disease comes under control on its own. Okay, you need not do anything fad. We are not talking about going to the gym, running around 5 hours of workout. No, nothing like that. Just be on the move throughout the day. The more you move, the less you're going to have problems.
Wow. So there's a lot of metabolism factors that are involved in PCOD. Am I right, ma'am?
Yes. So one thing PCOD, people come and ask, whenever you talk about insulin, they say insulin is for diabetes.
Yes.
Okay, so why are you talking about insulin to us? We are only coming for ovary problem or we are coming for periods problem. Why should we talk about insulin, which is a diabetic problem? Both are interrelated.
Okay.
Okay, what happens is that PCOS, the main problem is insulin resistance. Okay, what is insulin? Insulin is a hormone produced in the body from one of the organ called as pancreas. What is the role of insulin? Insulin is an anabolic hormone.
Okay.
It is the hormone which helps you to grow. If you want muscles, you want to have the insulin working in a right way.
Okay, ma'am.
So if you want to have other building up things, if you want to build up proteins, if you want to have collagen, everything is insulin's role. One of the added benefit is that insulin breaks down glucose so that the glucose level also comes down.
Okay.
That is the added benefit of insulin. What happens in this PCOS women? This insulin cannot act. There is a resistance which is developing. So because of the androgen level which is high, this androgen goes and prevents the insulin from acting. So they will have loads of insulin into the body, but the insulin cannot act. So that is what is called as insulin resistance. So that can be picked up by certain clinical features. Most of these women will have a black neck mark.
Okay.
We call it people think it's chain marks. They come and say, I used to wear big chains, so that is why my neck has become black. This we call it as acanthosis nigricans. And this is a sign of insulin resistance. And if you don't pick it up at that level, treat it at that level, these people are prone to become diabetes in the future.
So that's also an early sign of diabetes.
Yes, it is an early sign. Or already diabetes is there or future diabetes is going to come.
Okay.
So if your neck mark is showing black, even other areas, for example, the axillary area, below the breast area, sometimes even the crural area, like where the thighs meet the private parts. Those area also black skin marks. Okay, we call it as black silken and satin-like skin.
Okay.
Those are signs of insulin resistance.
Okay.
So they have to pick it up early, treat it in the lifestyle way, nothing else, no treatment, no medications. So more we believe is about lifestyle. If
Okay,
you
ma'am.
bring the lifestyle today, we can avoid diabetes in the future. Okay, so the decision is that either you do your change so that you don't take tablets. So
Beautiful message for the society. And I think our viewers are going to be young girls and adolescents and people who are trying to, implicate or include lifestyle management. So all the things that you have said are going to be much, much beneficial to them. And we have discussed a lot of points on what should be the diet, what should be the sleep time, all those things. For our viewers, if there should be any one point that they should take it today, what is that, ma'am? Any actionable point?
one point, if you want to take it from today's message, I will tell you is that don't do anything for short period.
Okay.
None of the fat diet works. Okay, there are loads of talks depending on your, like whether you want to do intermittent fasting or you want to go gluten free, you want to go on a paleo diet, you want to go on a keto diet. Okay, nothing works if you don't do it for a long time. Okay, there is no point in doing fat diets. Whatever you do, make it as a lifestyle. That is why in PCOS, the main treatment is lifestyle modification, which means your daily day, what you're going to do, we want you to modify that in a healthier way. Okay, and I get patients who come and tell me, we are vegetarians. Okay, they don't eat vegetables, they don't eat fruits, they don't eat rice. I mean, they don't eat nuts, they eat only rice.
Okay.
Okay, I have a word named for them. They are riceitarians rather than vegetarians. So if you're a vegetarian, make sure you eat the healthy options. See, there are loads of studies which have been including your probiotic as a treatment for PCOS. We have something called as dogma theory. Okay, that means a gut dysbiosis causing polycystic ovaries. Okay, most of your diseases, whichever, name it cancer, name it diabetes, name it hypertension, name it any disease, all are related to the gut dysbiosis, which means we have good bacteria in the gut. Okay, everybody has. Okay, so these good bacteria maintain the hormone balance and the metabolic balance in a person, not only women, for both men. If you eat probiotic every day, it can be natural. We are not telling about tablets. You can have natural probiotic. Any fermented, uncooked food has excellent probiotic.
Okay.
The best one is your curds.
Okay.
The overnight soaked rice water is good, but only the water. If
Not
you
the
are,
rice.
yes.
Okay.
If you are eating the rice, yes, but you have to do hard work to burn the calories which you got it from the rice.
Okay.
So water alone is good one, not the one where you drain the starch from the rice. That is not very good one. Okay, this overnight soaked is because it's fermented, it's healthy. Okay, the other where you cook it in a pot and you drain the water, that is fully starch. That is not healthy. So if you take probiotic every day, it can reverse every disease in your body.
Wow.
Okay, there are loads of things studies have told gastritis cures with probiotic. Your constipation cures with probiotic. Okay, those days our elders used to say, if your bowel is healthy, the overall body is healthy. That is what is the meaning of this probiotic being the reason for all the diseases in the body.
Okay.
So maintain a proper gut health. That will maintain a proper metabolic health of your body, and definitely no disease will be there.
Wow, beautiful message again, ma'am. So, as a person who's not aware whether I have PCOD or not, whether I have any disease or disorder, anything, how should I include this probiotics in my diet?
See, a dietary probiotic anybody can take.
Okay.
You need not bother whether it's PCOS or not. Because probiotics, excellent uses, it's been proven. Every disease it helps. Okay, so you can have a curds every day, it's healthy.
Okay.
So including a probiotic by diet, it definitely works for everybody. So maybe a small quantity, at least 90 to 120 ml is what we usually recommend. That amount of probiotic, if they can take it every day, it's going to be good for them.
Okay.
Okay, so when they go on a diet or anything, I don't want fat things. I have come to see people who come and tell me that doctor, we don't eat anything. Okay, morning I eat say a small amount of juice, then afternoon I take only one chapati, at night I take one carrot. I come across these diets. Okay, this will never help you to lose weight at all.
Okay.
And in spite of that, you'll be gaining weight if you're going to eat like that. Okay, because what we want is a calorie deficit diet, but not to a level where it reduces from your basic required amount.
Understood, ma'am.
So everybody has a basic required calories. So a minimum of 1100 to 1200 calories is needed for everybody to live. Why are we talking like that? Your body will recognize that, okay, I'm in famine. There is not going to be food tomorrow. So whatever the smallest portion you eat, that will be converted to fat and stored in the body.
Okay.
So, and you will be losing muscle. You are going to lose weight by losing muscle. PCOS is not about losing muscle. It is about losing fat and building muscle. So you have to have a high protein diet, and adding fiber will give you satiety. It will make you feel full. You don't eat much. And fiber, it's another name, is called as prebiotic.
Okay, ma'am.
Fiber are food which is not much absorbed by the intestine, but it serves as a food for the probiotic. And these probiotic are already there in the body. It is living with us. So if you give food for it, more will grow. So health is going to go up. So when you add fiber, one, the prebiotic role is there. Second one is that it gives you satiety. It feels you full. You don't feel like eating more. So your diet concept, if a single word, if anybody has to understand, is that you have to increase your fiber, increase your protein, and only reduce carbs.
Okay.
Reducing the junk food, sweets, chocolate, ice creams, bakery items, chaat items, that is going to help in a bigger way rather than not eating anything at all. If you don't eat anything at all, we are losing muscle, and that will make you prone for diabetes. You're going to become a diabetic rather than going to be of help.
Okay, so my diet should include protein, fibers, little bit of carbs, along with that a prebiotic or probiotic as well.
Exactly.
Okay, okay, nice. And also, ma'am, again, personal question. Like, I think I can ask that also. You mentioned about curd, but people will consume it as curd rice.
Yeah, no, definitely no. I mean, if your rice quantity is small, it's definitely good. Okay, as I told you, the overall rice is 4 spoon. So 1 spoon with curd, it's always healthy. Okay, but people take one full bunch of curd rice and they eat. That is definitely unhealthy.
Okay.
Okay, நிறைய சாப்பிட்டா. See, if you exercise well, you can eat anything. See, some people are gifted, I'll tell you. Some people have a very good basal metabolic rate. They are gifted people. Okay, but not everybody is not gifted. I have seen people who eat this big dabba. Nothing. They are absolutely normal people. No disease at all. I will tell them they are all God gifted people. Okay, they will not have problems at all. But others, whenever they have this kind of problem, see, usually, like if PCO is what we think, these heavy women, they'll be eating like that. Okay, like, sometimes people make fun. What is the size of idli you take? How many idli you take? You eat 10 idlis, 20 idlis. Poor thing is that these women, they don't eat that much.
Okay.
Okay, most of the women who are on the higher side, they don't eat much during the normal days. But they eat much during stress.
Stress eating.
Stress induced eating. So what I tell them is, you please separate stress from eating. If you're happy, don't celebrate, go out and eat. If you're sad, don't buy a chocolate or ice cream, eat it and make sure that you're okay. So desensitize these two things, separate these two things, and keep, like, your stress to a level and your food in another level. I think that will be the most helpful one.
Okay, ma'am. Okay. And one more important question that I would like to, I would like you to address is the birth control pill a cure or any treatment option for PCOD?
Yes. See, the first major treatment for PCOS is the diet. Okay. Then we have to go on to the next step when the diet is not helping. If a woman is not looking for fertility, she doesn't want to conceive, she just wants treatment for irregular cycles, definitely your birth control pill is the first choice.
Okay.
We take these hormonal pills at least for a period of 4 to 6 months continuously.
Okay.
People take 1 month, they leave it, they see it's fine. It doesn't happen at all. For a period of 4 to 6 months, it regulates your hormone which is inside. Okay, and it controls it. So this will help you to have a regular cycle, say for another 1 to 2 years. But PCOS is not a curable disease. This is a disease which can only be controlled. It
Okay,
means
okay.
the moment you leave these tablets, the moment you leave the diet, the disease comes back. The moment you go back on a diet, it is controlled. So it will be a problem which lives somewhere in the patient's body without making any issues, it will be there. The moment they leave the diet, it comes and gives all the symptoms there. So without lifestyle, only with OC pills, it's not going to be helpful. The second problem where people come back and say, I had PCOD, now it is cured. One understanding message which you should understand is it can never be cured. It can only be controlled.
Okay.
Okay, it is cured only when you have menopause. When your ovaries stop functioning, it never works at all. So if it never works, no hormone only, it doesn't have, but still there is a problem there. They can have future cancers also in PCOS.
Okay.
So that is the problem. The one more important message which people should understand is PCOS is not only related to ovary and the uterus. It is more worrying is about the metabolic syndrome.
Okay.
They can cause diabetes, they can cause hypertension, they can cause dyslipidemia, that is the cholesterols can go high. When you have all three diseases, your heart disease can come, and future you will have uterine cancer. So these are, I educate each and every patient who comes to me about these issues, because your OC pills or even a small period of dieting will not address all these five. Okay, so if only your long-term diet, your exercise, stress relief and sleep pattern will prevent you from having metabolic diseases.
Okay, ma'am.
So there's no point in knowing that you'll become diabetic, BP, then cholesterol, everything you're going to have, and then ignoring it is not the right thing to do. So address it now, be tablet free tomorrow.
Wow. Wonderful. Nice message, ma'am. So from the bottom of my heart, it was seriously very interesting, and
Thank
there was a
you.
lot of new information and lot of scientific facts and lot of information, ma'am. So
thank
thank you
you.
so much for joining us, and I really hope this message goes to the right audience and they all follow a healthy lifestyle.
Yes, thank you. If at least one person changes seeing this video, I'll be more than happy, because bringing in a healthy lifestyle is more important rather than treating them after the diseases have come. So thank you for the opportunity.
Thank you, ma'am.